It's time for our KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning, Chris. Morning, Paul J.
Morning, Doc. Aspirin has long been called a wonder drug. It's been around since the 1890s and has been suggested as a treatment for just about everything, all sorts of conditions, but it might not be a good idea for certain older folks. What's the story here?
Yeah, there's a very large international study which just came out, which suggests that aspirin, even at low doses, these doses may be harmful without providing any benefit, particularly for older people who have not had a heart attack or stroke already.
Now, what would be the concern about daily low-dose aspirin for people who have not previously had a heart attack or stroke?
The concern, which has really always existed with aspirin, is the significant risk of internal bleeding or GI bleeding caused by the medication, which irreversibly inhibits platelets. A key takeaway from the study's co-author is for healthy people who are 70 and older who don't have a reason to be on aspirin, such as a previous heart attack or stroke, there isn't any demonstrable benefit from daily aspirin use. As always, this is probably something good to talk about with your doctor.
Always seems to be questions and comments and suggestions about what expectant mothers should be eating. Sounds like there's no doubt whatsoever about one food item that should absolutely be on their weekly menus. What is it?
Yes, that's right. That's certainly the conclusion from researchers at the University of Turku and Turku University Hospital in Finland. They strongly state that women could enhance the development of their unborn child's eyesight and brain function by regularly eating fatty fish throughout their pregnancy.
Just how regular does that fish consumption have to be?
Well, it doesn't have to be 3 times a day, but they suggest that having fatty fish like salmon or albacore tuna or lake trout 3 or more times a week seem to be optimal, especially during the last trimester of pregnancy.
As long as we're on a food tear this morning, what else is it that we're just not getting enough of?
In a word, it's fiber. According to the most up-to-date dietary guidelines for Americans, the adequate intake of fiber for adult men is 33 or 33.6 grams per day and 28 grams per day for adult women. The problem is most people in America don't meet this goal. The average fiber intake in the U.S. is 17 grams a day, and only 5% of us meet the adequate daily intake.
Now, Doctor, remind us again about why we need to be concerned about getting a bigger fiber fix.
Yeah, the fiber fix helps or gives us many benefits. It keeps our guts healthy, it boosts our heart health, and it promotes weight loss. And it's as easy as adding more fruits or vegetables or legumes and whole grains like bulgur wheat and peared barley to our diets. Tasty foods can be added to any meal.
All right, so fiber up, right?
Exactly, fiber up.
Fiber up. All right, Doc, thank you.
Yeah, thank you, Dr. Bramwell, for your time on KBOI this morning.
Okay, thanks, Chris. Paul J.
Bye-bye.